It is another exciting edition of your favorite program, Health Affair on AIT, a program where we discuss critical public health issues with a view to finding lasting solutions. I am your host, Ushuomo Daniels. Today, we shall be focusing on the plight of persons living with disability and their challenges in the COVID-19 pandemic. But before then, let's take you to our news segment for some reports.
Commitment made at the virtual G7 leaders meeting hosted by the United Kingdom Prime Minister Boris Johnson and at the Munich Security Conference signaled significant progress in the global response to the COVID-19 pandemic, with an important underscoring of the need for global equity in access to tests, treatment and vaccines. The UK's commitment to join Canada, France, Norway, and the European Union in sharing its additional vaccine doses with developing countries is a vital step to increase volume of vaccines available worldwide and reduce the rapid transmission of the virus. Leaders have recognized that no country can be safe until every country is safe and collectively committed over 4.3 billion US dollars to the ACT Accelerator Partnership to develop and distribute effective tests, treatments and vaccines around the world. The ACT Accelerator Partnership welcomes new investment from the United States of America, USA, Germany, the European Commission, Japan, and Canada to fund the development and equitable rollout of tests, treatments, and vaccines needed to end the acute phase of COVID-19 pandemic. Health authorities in Guinea declared an Ebola outbreak on the 14th of February after three cases were detected in a border community between Guinea, Liberia, and Sierra Leone. In a swift response to contain the spread of the virus in Guinea and the Democratic Republic of Congo, where a case was also recorded, the World Health Organization (WHO) deployed a team of experts, including some Nigerians, to the countries affected.
We all agreed to work very closely with the government of Guinea, and we offered to send a team of experts from our Center of Excellence to go to Guinea and help them. Meanwhile, the WHO is taking steps. As you know, they already have vaccines for Ebola. They are doing what we call ring vaccination to encircle the whole area there.
The briefing provided an opportunity for the minister to give an update on the COVID-19 vaccine and efforts made to ensure oxygen sufficiency across the country.
75% of all the vaccines produced so far is being used in 10 countries, only 10. The others are not getting. So even if you have your money and you go there now, they won't give you the vaccine because they have to satisfy the needs of those countries who have paid before and who have paid big, big money. So even if you have your money and you go there now, they won't give you the vaccine because they have to satisfy the needs of. So the next issue we have now is the issue of asking those countries who have ordered surplus, because some countries have ordered surplus, to release some of their own vaccines. And just yesterday, France suggested that all those countries will release 5% of the vaccines they ordered. I myself, I put my mind on the fact that it may not be, that it may be early March. We are scrambling to quickly make do with oxygen, to have oxygen sufficiency all over the country. The federal government has ordered one oxygen plant for every state. Some states will have two. So those oxygen plants will be able to provide most of the oxygen that we need.
Also gave hints of plans to train more health professionals and improve their working condition to address the increasing rate of migration abroad by medical personnel for greener pastures. The Lagos state government has deployed a verification platform to validate the authenticity of COVID-19 PCR tests done within the private laboratory consortium and all state public laboratories for outbound flights. The platform, which became necessary to check rising cases of fake COVID-19 test results, can be accessed through an app and the use of USSD, unstructured supplementary service data codes. The USSD option, which is available on all networks in Nigeria, can also be accessed outside of Nigeria as long as the mobile line is on a Nigerian telecommunications network. The USSD option can be accessed by dialing star 351 31 star 19 hash on 9 mobile network, star 5500 star 19 hash on all other networks. The first 30,000 result verification, according to the state government, will be free, while subsequent verification will attract 50 naira per usage for the user.
If you buy a pack of face mask, is 3,500 naira. I have a pack in the office here. When I went, by the way, I was carrying a face mask that is 500 naira worth, because it has a vent with it that allows you to breathe more freely than this type. So they are giving me this type, and they charged me 1,000 naira. So I protested.
Amos Kunat is a concerned Nigerian who was charged 1,000 naira for a regular nose mask sold at the chemist for 100 naira at a diagnostic center in Lagos. Though he is rich enough to afford the cost, but not many Nigerians can, especially in an already battered economy where many have lost their source of livelihood due to outbreak of the COVID-19 pandemic.
If Nigeria is ever going to be right, it's not angels in heaven that will come and put it right. It is you and I that will make this country right. Okay? And then I also want to advise that the private sector, you and I, we should also contribute our quota and be our brothers' keepers by assisting, by giving services within what people can afford.
We visited the diagnostic center to get their side of the story, but we were reliably informed that the manager was not on seat to speak on the issue. Beyond the exploitation of people with the nose masks, Reverend Amos and some others are also not happy about this falsification of the COVID-19 test result.
If somebody can issue a certificate to someone when he knows that the person did not go through the test, that person is absolutely corrupt. In other words, what he is saying is that just pay me my money for the certificate and take it away. So if you are carrying COVID, it doesn't matter how many people you spread it across or you spread it to. It doesn't matter. If they die, let them die. That's their business, so long as I have collected my own money. So it means that society, or we are exchanging life for money. And that is the height of evil.
So this is an issue that the federal government especially has to look into. How people are getting results, fake results, without being tested and entering the country. So if this continues, we're going to see an exponential increase.
They noted that if the country must move forward, all hands must be on deck to kill corruption and all the negative factors holding us down as a people.
Welcome back. The United Nations Convention on the Rights of Persons with Disabilities says all persons with disability should be able to access the highest level of health care services without discrimination. Despite this provision, such persons have continued to encounter challenges to health care due to inability to access health infrastructure and transportation, a situation that has worsened with the COVID-19 pandemic. I spoke with a cross-section of disability inclusion advocates in Lagos.
Inaccessible infrastructure. For a person with disability to go to a healthcare facility, it must be accessible. Whether you're on wheelchair, whether you're on the wheelchair, whether you use your walking aids to move about, whatever form of assistive, even if you're a blind person, you should be able to gain access without support. When we talk of COVID-19, we are talking of physical distancing. Now, when people have to hold you, lead you in, it's not just putting you at risk, but also putting whoever is touching you at risk. So we're looking at a more accessible environment. Some types of disability, we look at the intellectual, for instance. These are people who live with cerebral palsy, those with Down syndrome, those who are autistic. These people depend on their caregivers, and from time to time, they have their routine therapies to go for. And in the midst of this pandemic, everybody is scared because, of course, we know that generally any form of health challenge you have now, until proven otherwise, you are suspected to have COVID-19. So it's a big problem for you to go to the health facility to access any of these therapy sessions. For women and girls with disability, our sexual and reproductive rights matter because we are, first of all, women before our disabilities. And so we need to access, whether it's our antenatal, whether it's our family planning. Of course, we are sexually active, and we need to access these facilities. When we go for family planning, are the devices, are they accessible? The weighing scales. How do you weigh a woman on a wheelchair? For me, who stands with my walking aids, do I throw them away so that I can be weighed? Because I know that you cannot access family planning without being weighed. I have volunteered for years in a health facility, so I'm talking from experience. Does government have disaggregated data of persons with disability? You cannot work for a group of persons with this kind of population. Let's take, for instance, Lagos, where we have over 2 million persons living with disability. How do you cater for these people if you do not have their disaggregated data? When we come into a facility, we expect that there's a column that captures persons with disability who come in. We are looking at a pandemic where even if we are tested positive, God forbid, but who knows, we're supposed to go into isolation. Are the isolation centers, are they accessible for persons with disability? Do they have ramps? Are their beds accessible that I would be able to climb on without having anybody to assist me? If a deaf person is tested positive, how does she cope with her medication and everything? Who is that person who is going to interpret to that person? These are some of the concerns I have as an inclusion advocate. How do we access medical care as persons with disability? And that is why I want to appreciate Lafia Project for making this a very robust conversation for us as a community. This is spotlighting the challenges that people on a daily basis overlook. How accessible are the information formats that we have? Look at a blind person, for instance. If you do not have information in Braille format, that community is disenfranchised, and that means they would not be able to read whatever it is you are putting out there. Any form of barriers we face, it means that we are not carried along. And it means that the SDGs of leaving no one behind is not captured. The issues of COVID-19 has gone beyond palliative. We are talking of sustainability. How do persons with disability have proper livelihoods? We are talking of health schemes that will make it subsidized for persons with disability. Imagine a man who is living with albinism and has cancer issues. How would that person, and he or she does not have a job, how do they foot their bills if it is not subsidized? We are looking at a dwarf. How does a dwarf access some of these health stuff we are talking about? They are part of the community. I'm looking at that remote village where someone living with leprosy is there, isolated even before the pandemic. That is isolation before isolation, where that person is already set aside. That person already feels left out. And now you have another pandemic that also heightens the anxiety you have. Living with a disability is not an easy task. We have a Disability Act that says we should access free health. We have the Lagos State Special People's Law of 2011, which also talks of free health. And this is beautiful. But beyond that, we need monitoring and evaluation to make sure that it is not only written on paper, but that the people who need to access these things access it when due. We are encouraging the government and all stakeholders, because the government cannot do it alone. Every stakeholder should please help us to amplify our voices, that this community of over 25 million people in Nigeria, over 2 million in Lagos, our voices count.
There's a story of someone who she is a wheelchair user. She was pregnant, and at the time of her delivery, because she could not get someone to assist her immediately to be on the delivery bed, she lost the baby. And she's someone living with disability. You know, because of her weight and because of the way her disability, they were not able to give her a prompt, immediate assistance that she needs. And so it happens like that. So that's why we need to have someone who is there, who understands, who knows that this is what needs to be done. And then they need to put it right. And another thing I will suggest to the government is that there should be an helpline whereby the person living with disability can make call, maybe call for health provider, or call for an ambulance, or call for somebody to come and assist in the while home care, a kind of home care. There should be kind of home care for person living with disability, because while we go to the hospital, we're trying to struggle with somebody who is not having physical challenge. But if there's a way or a kind of call, a free call that a person with somebody who is physically challenged can call to require for health assistance, I think it will go a long way to help, rather than going to the hospital, having to queue or to access a doctor and every kind of things like that. And online interaction too can also be whereby you can maybe chat with your medical practitioner online. It can be able to assess you, can be able to tell you this is what you need. You can be able to express yourself to the doctor even while you are not in the hospital. When you are at home, you can be able to talk to your doctor. This is my issue, this is what is wrong with me, and the doctor should be able to treat you even in the comfort of your home.
The COVID-19 affected our people a lot. That is the deaf community. By not having access to enough awareness, all the announcements on TV are not being captured or with interpreter. Our major problem is communication. That is our major problem. And many of them, they can't, maybe if they are sick, they can't go to hospital because of interpreter during that COVID-19 period. It's very, very hard for them, hard on them. So, like myself now, for example, during that time, I was sick, but the doctor was using mask to explain things to me. No how that I'll be able to understand him. But if we have interpreter there, it should be very easy for me to understand him, to explain my own problem to him. So many of our deaf are there. They can't go to hospital during that time when they are sick. because no interpreters. How will they be able to understand what the doctor is telling them? And some of them, they can't write well. That is another area. On radio, deaf can't listen to radio. Not possible. It's not possible. On TV, no interpreter to interpret what they were saying to them. So the government, they are trying, really, they are trying in taking care of special people. But we still need more awareness, more interpreters in our general hospital.
Next on the show is our nutrition segment, and the focus today is on walnuts. The African walnuts are fruits of a woody perennial climber plants found mostly in the dense rainforest of Africa. It comes in a hard kernel casing, which releases a whitish round nut when cracked open. The shell color ranges from black to any shade of brown. The fruit has a firm and crunchy texture with mild flavor when cooked, but upon drinking water after consumption, it gives a bitter taste sensation attributed to the presence of some variants of chemical alkaloids and phytochemicals, which has no toxicity and of no danger to humans. African walnut has a long history as food plants. Its economic importance lies in the edibility of its oil-rich endosperm, which is consumed by diverse populations in Nigeria, Sierra Leone, and the Lower Congo region. Although it is believed to have originated in southwest Nigeria, where it is usually cultivated by subsistence farmers, in the hot and humid zones of tropical Africa, in compound gardens and backyards, just for family and local market consumption. Today, it is widely cultivated from Sierra Leone to Angola and in the Democratic Republic of Congo, Nigeria, India, Cameroon, Gabon, and Niger. Every part of the African walnut tree is used in both raw and finished states. Its timber and nuts are used to produce medicine for kidney problems. The wood is used to make pilings for bridges and railway ties. The fruit is cooked with its shell at a boiling point temperature, above the boiling point of water, and left for up to 10 minutes on fire. It is served with its shell, which must be removed before eating. In a similar way, it can be baked in the oven by placing raw nuts on a pan and put in an oven for 15 to 20 minutes. They can as well be served roasted as healthy snacks. African walnuts are seasoned fruits with enormous nutrition and health benefits. These nutritional contents in walnut provide immense benefits to the human body in several ways. The nutrients include antioxidants, minerals, vitamins, and some plant compounds that the body requires daily for overall maintenance and development. A 100-gram serving of shelled walnut contains or supplies 350 kilocalories of energy, 13.14 grams of carbohydrates, 24.0 grams of protein, 12.39 grams of fats, vitamin C, vitamin E, vitamin B6, B7, and thiamine, minerals, calcium, potassium, magnesium, zinc, and sodium, omega-3 and 6. African walnuts help to prevent some mineral and vitamin deficiency. Eating this fruit helps also to protect you from certain chronic diseases. It is time for our medical instrument segment, and we shall be telling you today about the thermometer. A thermometer is a device used for measuring temperature of the body, solids, liquids, or gases. The common units of measure are Celsius, Fahrenheit, and Kelvin. There are different types of thermometers, but for the purpose of today's program, we shall be focusing on medical or clinical thermometers. The clinical thermometer is used to measure the temperature of the human body and mostly consists of mercury. They are sensitive and accurate, having a narrow place where the level of mercury rises up to very fast. These kind of thermometers are used in clinics by medical doctors and other medical staff. Medical thermometers must be cleaned before and after each use with alcohol. Let's take you to our clinical segment for tips on healthy living.
I'm a practicing family physician. We always emphasize the need for appropriate lifestyle practices. So let Nigerians have, some remodeling and reprioritization of their health habits. So sleep enough, eat well, eat proper diet, indulge in exercises, avoid those risky behaviors like smoking, alcohol consumption.
Please call the numbers shown on your screen. Your opinion counts on how we can improve the nation's health sector on our perception segment.
Somebody that put the face mask just under the chin, covering the mouth alone, leaving the nose uncovered, has not used the face mask correctly.
I hope you've benefited much from the program today. Please join us again same time next week. My name is Oshuomowa Daniels. Your health is your wealth. Please pay attention to it.